So that's about the data that we are getting from payer, the data we are getting from the clinical. But going deep, and last year I talked about the Mediterm AI in detail. The reason why we built Mediterm AI was we were not able to get the maximum value of the clinical data. And the reason was there were just a lot of non-standard codes that was there. The non-standard code is there, but it's not usable because you cannot correlate, you cannot use it for analytics purposes, you cannot use it for the application. And when we did a double click across multiple customer environments, what we saw, the non-standard code presence is anywhere between 8% to 95%. That's a huge number, right? So in order to solve it, the Mediterm AI foundationally works on 3 layers. Layer 1 is to locate the problem. Layer 2, it looks into what are the recommendations to resolve the problem. And layer 3 is about rectifying the problem, to resolve the problem. So this dashboard is available in all of our customer environments. You can see that what's the percentage of non-standard code at the source level that you are getting. So you will get a different entry for Cerner versus a different entry for Epic versus a different entry for Athena in that sense. So you're not going into the ocean of information. You can actually go and see that if there is a particular practice which is kind of giving you a lot of non-standard code versus a particular EMR giving you a lot of non-standard code. So with that, the Mediterm AI not only talks about the category level impact, but it also talks about the source level impact. In order to resolve this, all we need to do is we need to go through the normalized journey. And thanks to our partnership with Wolters Kluwer, I'm sure all of us know, they have kind of matured their AI algorithm, and they have a very rich library of crosswalks that is available. What it does behind the scene, it goes through those clinical concepts to map the non-standard code with a standard code to, again, drive the usability of data. And the moment that mapping gets confirmed by a human, this data automatically goes behind the scene and gets updated, and you see a drastic kind of reduction happening. With this, we did the pilot on few of the customers, and what we are able to see, there is a 91% improvement in the vitals category. That means out of 9 standard codes, we are actually able to map 9 out of 10 non-standard codes. We are actually able to map 9 successfully with a standard code. That's a huge, huge kind of usability-related driven things, right? And with that, we are able to see 15% improvement in the overall quality measure outcome. That's significant. That's significant. And this data has been there all the time. It's just we were not able to use it. With Mediterm AI, we are able to use it. Last but not the least, delayed data is a lost opportunity. We know that. And to solve that problem, we are unleashing the power of real time in 2025. That means what will happen is the moment an admit, discharge, or transfer that happens into a hospital, the information will be made immediately available to our care coordinators so that they can start taking action. They start kind of driving the outcome as well. So more power to all of you in terms of real-time actionability, trust in data, Copilot for the faster time to value and everything. And thank you for being an amazing support. I would like to invite Jim to talk more about the innovations in the analytics space. Thank you.